Medical surgical nursing is the backbone of adult patient care, covering preoperative to postoperative stages. It requires a holistic approach, addressing multiple body systems and considering psychological, social, and spiritual health aspects. Nurses in this field must be adept in clinical reasoning, technical skills, and therapeutic communication to manage diverse health conditions effectively. Medical surgical nursing is the most comprehensive nursing specialty, focusing on health promotion, maintenance, and restoration in adults. It requires broad clinical knowledge and versatile skills to manage acute and chronic conditions. Nurses must excel in assessment, clinical reasoning, and therapeutic communication, addressing multiple body systems and holistic patient care across diverse healthcare settings. The aging global population has transformed medical surgical nursing, with most patients now over 65. Nurses must understand geriatric syndromes, polypharmacy, and chronic conditions. Age-related changes affect responses to treatments, requiring specialized skills. Hospitals implement geriatric protocols, and units manage higher acuity patients, impacting education, staffing, and care coordination. Medical surgical nursing spans various settings, each with unique demands. Inpatient units require broad clinical knowledge for diverse diagnoses. Ambulatory clinics focus on pre- and post-surgical care, emphasizing patient education. Rehabilitation centers prioritize recovery and independence. Home care demands autonomy and family involvement. Nurses must adapt core principles to each environment, ensuring quality and safety. Medical surgical nursing has transformed from basic bedside care to a sophisticated specialty. Originating with Florence Nightingale's principles, it evolved through the 20th century, expanding roles with medical advancements. By mid-century, it emphasized the nursing process. Today, it incorporates evidence-based practice and informatics, positioning nurses as clinical leaders and care coordinators in diverse settings.
Medical surgical nurses systematically assess patients' physical, psychological, sociocultural, and spiritual health, conducting thorough examinations and reviewing diagnostics. They develop individualized care plans, setting goals, and selecting interventions collaboratively. Implementation involves direct care, education, and advocacy, while evaluation refines care plans based on patient responses. This comprehensive approach addresses both chronic and acute conditions, requiring expertise in diverse patient management. Medical surgical nurses serve as care coordinators, synchronizing interventions and facilitating communication to ensure seamless patient care. They educate patients on health conditions and advocate for their preferences. As leaders, they direct care delivery, mentor colleagues, and drive quality improvements while also applying critical thinking in complex clinical situations. Effective collaboration in medical surgical settings involves a diverse interprofessional team, including physicians, nurses, therapists, and more, each contributing unique expertise. Structured communication tools like situation background assessment recommendation ensure clear exchanges, while interdisciplinary rounds facilitate coordinated care. Shared decision-making respects each discipline's input, enhancing patient outcomes and satisfaction through comprehensive, patient-centered approaches. Evidence-based practice, EBP, is vital in medical surgical nursing, merging research, clinical expertise, and patient preferences. Nurses use the PICO format to guide decisions, integrating evidence into practice. Examples include fall prevention and pain management. Barriers like time constraints and resistance require supportive leadership and continuous learning to ensure interventions reflect current science. The Quality and Safety Education for Nurses (QSEN) initiative equips medical surgical nurses with essential competencies: patient-centered care, teamwork, evidence-based practice, quality improvement, safety, and informatics. These competencies guide nurses in involving patients in care planning, collaborating with teams, integrating research, and utilizing technology, ensuring high-quality, safe patient care in complex healthcare environments. Patient-centered care shifts focus to individual patient needs, values, and goals. Medical surgical nurses adapt care to respect diverse beliefs and engage in shared decision-making, empowering patients. Involving families and caregivers is crucial, as is providing emotional support and preserving dignity. This approach enhances outcomes, satisfaction, and adherence, despite the technical demands of nursing practice. Implementing evidence-based practice in medical surgical nursing involves translating research into care protocols, adapting interventions to individual patient needs. Nurses apply evidence-based approaches like selecting wound care products, early mobility protocols, and validated pain assessment tools. Ongoing education and participation in research enhance understanding and ensure interventions are supported by current evidence while addressing unique patient needs. Quality improvement in medical surgical nursing is a continuous process, focusing on enhancing care delivery. It involves identifying quality concerns through data, analyzing root causes, and implementing solutions using Plan, Do, Study, Act cycles. Nurses play a crucial role, identifying problems, suggesting solutions, and evaluating outcomes, fostering a culture of safety and transparency for sustained improvement. Barcode medication administration systems enhance safety by verifying the 5 rights of medication administration. Smart infusion pumps with drug libraries alert nurses to potential errors, reducing adverse drug events. Electronic documentation and secure messaging improve care continuity and coordination, while legal implications highlight the importance of accurate, time-stamped records in nursing informatics. In medical surgical nursing, prioritization and critical thinking are vital. Nurses use frameworks like Maslow's hierarchy and the airway, breathing, circulation to assess urgency and make clinical judgments. Acuity-based prioritization ensures unstable conditions are addressed first. Delegation of tasks allows focus on complex care, while the nursing process organizes information and establishes care priorities in dynamic settings. Patient education is crucial in medical surgical nursing, impacting treatment adherence and outcomes. Nurses explain diagnoses, symptoms, and treatments in understandable terms, balancing honesty with hope. Medication education covers purposes, dosing, and side effects, using teach-back methods to ensure understanding. Self-care skills are taught through demonstrations and practice, tailored to learning styles and literacy levels. Effective transition and discharge planning in medical surgical nursing starts at admission, evolving with patient needs. Nurses assess discharge risks early, addressing factors like complex medications and limited support. Comprehensive preparation includes medication management, symptom monitoring, and follow-up scheduling. Collaboration with multidisciplinary teams ensures seamless transitions, while post-discharge follow-ups reduce readmissions and enhance outcomes. Leadership in medical surgical nursing involves advocating for patient care, implementing evidence-based practices, and mentoring colleagues. Nurses lead quality improvement by identifying enhancement opportunities, proposing solutions, and measuring outcomes. They ensure patient safety by preventing adverse events and modeling safety practices. Change advocacy requires political awareness, strategic thinking, and coalition building to improve patient care. Identifying post-operative shock is crucial. A vital sign pattern of blood pressure 80-50 millimeters of mercury, pulse 140 beats per minute, and respiratory rate 32 breaths per minute indicates shock. This triad, hypotension, tachycardia, and tachypnea, signals compensatory mechanisms for decreased cardiac output. Early recognition allows for timely interventions like fluid resuscitation to prevent irreversible damage. Supporting the incision with a pillow during coughing, known as splinting, effectively manages incisional pain by providing counterpressure. This minimizes stress and movement, reducing pain while allowing effective secretion clearance. Pre-medicating with opioids doesn't address mechanical stress, and shallow breathing or post-cough ice packs are less effective in preventing complications like atelectasis. Acknowledging a patient's anxiety before surgery is crucial. The nurse should say, "I understand you're feeling anxious. What specific concerns do you have about the surgery?" This response validates the patient's feelings and encourages open communication, allowing the nurse to address specific fears with accurate information and reassurance, enhancing patient-centered care. In cases of sudden respiratory distress with a Sangsteichen-Blakemore tube, the nurse must immediately cut and remove the tube if the distress is severe. This action addresses potential tracheal compression by the balloon, a life-threatening emergency. Emergency scissors should be readily available to ensure swift intervention, prioritizing airway restoration over notifying the physician. The symptoms of severe rectal bleeding, frequent diarrhea with mucus, lower abdominal cramping, and weight loss suggest ulcerative colitis. This condition involves continuous inflammation and ulceration of the colonic mucosa, primarily affecting the rectum. The inflammation leads to bloody diarrhea and weight loss due to poor nutrient absorption and increased metabolic demands. Recognizing these symptoms is crucial for appropriate diagnostic testing and managing potential complications. Rotating insulin injection sites is crucial to prevent lipodystrophy, which involves abnormal changes in subcutaneous fat tissue. Repeated injections in the same area can lead to lipoatrophy or lipohypertrophy, affecting insulin absorption and blood glucose control. Systematic site rotation minimizes tissue damage, ensuring more consistent insulin absorption and glucose management. Ensuring complete bowel cleansing is crucial for accurate barium enema results. Residual stool can obscure findings, leading to false results. The preparation involves dietary restrictions, laxatives, and enemas. The nurse must ensure adherence, assess effectiveness, and communicate any issues to radiology. While nothing by mouth status, procedure explanation, and anxiolytics are helpful, they don't impact image quality like bowel cleansing does. In cases of wound dehiscence with evisceration, after covering the wound with a moist, sterile dressing, the nurse must notify the surgeon immediately. This is a surgical emergency requiring prompt evaluation. While positioning the patient supine with knees flexed can reduce tension, it should not delay surgeon notification. Applying an abdominal binder is inappropriate due to potential tissue damage. In a situation where a post-abdominal surgery patient is found unresponsive with no breathing, the nurse must immediately activate the emergency response system while assessing responsiveness. This aligns with basic life support guidelines, ensuring rapid arrival of emergency personnel and equipment, crucial for effective resuscitation and addressing potential complications like pulmonary embolism or hemorrhage. Prioritizing wound care, activity restrictions, and recognizing when to seek medical attention is crucial for preventing post-operative complications. Proper wound care prevents infections, while activity restrictions avoid strain on the incision. Recognizing warning signs like fever or increased pain ensures early intervention. Teach-back methods and written instructions enhance patient understanding and compliance. Medical surgical nursing is the cornerstone of healthcare, blending technical skill, critical thinking, and compassionate care. Mastery of patient-centered care, evidence-based practice, and interprofessional collaboration is crucial. As healthcare evolves, this specialty remains vital, demanding lifelong learning and professional growth to ensure comprehensive patient care.